My name is Tony, and I will be teaching you Introduction to Cross-Sectional Anatomy of the Brain. But today, not only are we going to learn some brief cross-sectional anatomy of the brain, we're going to focus on the optic center of the brain. Okay, so let's talk about just a brief overview of the brain. As we all know, the brain is a complex organ. It controls thought, memory, touch, motor skills, vision, breathing, temperature, hunger, basically every process that regulates the body. A really cool fact to know is that, just for fun, is that it weighs about 3 pounds. It's about 60% fat, 40% water, protein, carbs, and salts. Another really interesting fact is the brain can generate about 23 watts of power. That's enough to power a light bulb. This is just a nice cross-section or a sagittal slice of the brain. You don't need to know all of these names right now, but I can assure you, once you are done with the anatomy or cross-sectional anatomy of the brain, you will know all the inner workings, and all of these labels you will definitely know. But like I said, we're going to focus on the optic center of the brain today. So let's talk about just the basic anatomy of the eye. We've got our lens, so that's the front portion. We've got the retina, which is the back portion. That's the part that processes what we see. The optic nerve, very important to remember, because as an MRI tech, that is probably the number one thing you're going to have to know. We've got the lateral rectus muscle and the medial rectus muscle. You can see that all through the diagram there. Again, we have some more muscles of the eyes here. We've got the superior oblique, that is the top portion, the superior rectus, the inferior oblique, that's below the eye, the inferior rectus, and the lateral rectus muscles. All of these muscles, with this slide and the slide before, they're basically the muscles that allow your eye to go up and down, see left to right, move in a circle. Those are all you really need to know about the muscles. So this is a great slide because it's a pretty simple slide, but it shows you the globes of the eye. You can see then the optic nerves that are exiting through the back of the orbits, and then they cross over at the optic chiasma, which is definitely one of those important terms that you're going to need to know in MRI, because when you're planning or when you're looking at this area, you always want to make sure you address the optic chiasma. Okay, so why do we worry about the optic center as an MRI tech, and why do we need to image it? Well, one of the main reasons we image is to identify ocular and orbital tumors. A patient could be coming to you with reduced visual acuity, reduced color vision, possibly have an infection in that area or on the optic nerve, or even one of those muscles that we were talking about before, or a loss of control of eye movement. And how do we image this area? It's best to first plan off of your axial image first. Make sure that your slices cover all that area from the lens all the way through that famous area that I was telling you about, the optic chiasma. So again, here is an example of an axial slice that does include those parts that I was telling you about, which is going all the way from your orbit to your optic nerve, or you see the optic nerve, I should say, going to that famous word again, that optic chiasma. The next slice is actually going to show you slices that we're going to see from an axial perspective. So like I said, in this example, you can see there's these slices that go all the way from the lens all the way through the optic chiasma. This is just a great illustration so you can see what happens when you're planning to look at this area. So, you're all done with the patient and you're looking at their images. This would be a great example of something that's pretty obvious, and it's unfortunate for the patient, but this would be an example of a tumor that we see that's actually on the optic nerve there. You can see where that arrow is pointing to the tumor itself.